Outlining how Indonesia can capitalise on its demographic dividend was the key message addressed at the United Nations Population Fund's high-level forum in Jakarta on April 20. Hosted jointly with the Indonesian Demographers Association, around 100 people gathered together for the event at the Pullman Hotel in the nation's capital. Officially opened by Indonesia's Vice President Jusuf Kalla, the meeting was also attended by ministers, business leaders and representatives from the private sector, UN agencies and development partners. UNFPA's Executive Director, Dr. Babatunde Osotimehin, led the discussion at the event and highlighted how the world's fourth most populous country could achieve the dividend and reap the benefits of its associated economic growth. As the chairperson of the World Economic Forum's Global Council on Demographic Dividend, Dr. Osotimehin emphasised to the room that further investments in reproductive health, youth education and employment needed to be scaled up to achieve sustainable economic and social development in Indonesia.
Sustainable development is about inclusive development. Inclusive development is about inclusive growth, and that is very important. So we at UNFPA and as part of the USCT will continue to support government in what it's doing and make sure that what they require in order to be able to do this, we can do it effectively.
Indonesia's Vice President Jusuf Kalla echoed Dr. Osotimehin's message in his keynote address, stating that without good economic policy, the demographic dividend could turn into a burden.
Namun kita juga mengetahui bahwa jumlah saja tidak cukup, harus kualitas. Karena apabila jumlahnya yang menjadi pegangan, bisa menjadi beban yang besar. Karena itulah maka kualitasnya juga harus cukup baik.
With Indonesia's current population of young people aged 10 to 24 at 66 million, Dr. Osotimehin stressed that investments in health needed to include access to information on comprehensive sexuality education.
Every young person must know about his or her body. And also, we have to ensure that they have access to reproductive health services so we can prevent HIV, we can prevent sexually transmitted infections, we can also prevent teen pregnancies. Because that is the only way they can mature to be able to make choices in their lives.
Joining UNFPA's Executive Director on the panel was the Minister of National Development Planning, Dr. Adrenof Chaniago, the Minister of Health, Professor Nila Muluk, and the Secretary of the Coordinating Ministry of Economic Affairs, Dr. Lukita Dinarshotuwo. Speaking on behalf of the ministry, Dr. Lukita explained to the room that in order for Indonesia to capitalise on its demographic dividend, people needed productive jobs and needed to save.
Bonus daripada penduduk usia kerja itu akan dapat maksimal apabila mereka bisa bekerja. Bekerja pun tidak hanya sekedar bekerja, tetapi kita ingin mereka bekerja yang produktif sehingga bisa mendorong pertumbuhan ekonomi secara maksimal dan akhirnya mampu menabung untuk kehidupan di hari tuanya nanti.
Indonesia's demographic window of opportunity is expected to occur between 2020 until 2030, where the ratio of people at a working age to those of a non-working age will peak.
Indonesia's population is now composed of more working age people than ever before, both in absolute numbers, at 157 million potential workers, and as a proportion of the total population, accounting for 66% of the population.
In Jakarta for the World Economic Forum on East Asia, Dr. Osotimehin's message was clear. People need to be at the centre of development.
We need to make sure that it comes back to responsibility. Thank you very much.